Hello, this is my presentation on dyslexia. Dyslexia is a learning disorder that involves difficulty reading due to problems identifying speech sounds and learning how they relate to letters and words. This is also called decoding. Other things to know about dyslexia is that it is also called a reading disability. It affects the area of the brain that processes language. People with dyslexia have normal intelligence and usually have normal vision. Most children with dyslexia can succeed in school with specialized education programs. Emotional support also plays an important role. There is no cure for dyslexia. Early assessment and interventions result in the best outcome. Sometimes dyslexia goes undiagnosed for years and isn't recognized until adulthood. It is important to be able to recognize the symptoms of dyslexia. This includes problems with learning to speak and learning letters and their sounds, organizing written and spoken language, memorizing number facts, reading quickly enough to comprehend, spelling, learning a foreign language, correctly doing math operations. Some specific signs for elementary age children may include trouble remembering simple sequences such as counting to 20, and difficulty remembering spoken directions, names of places and people, hard time understanding the rhyming of words, and trouble easily clapping hands to the rhymes of a song, trouble recognizing words that begins with the same sound, pronunciation difficulties, and difficulty with word retrieval. Not all students who have difficulties with these skills have dyslexia. Formal testing of reading, language, and writing skill is the only way to confirm the diagnosis of a suspected dyslexia. There is an emotional and social aspect of dyslexia, and this includes lack of confidence, stress and anxiety, self-image issues, and depression. Students with lack of confidence often undermines their skills and knowledge and seems to assume that because they have difficulty in reading, spelling, and writing, they cannot do anything well. Stress and anxiety is also present in students with dyslexia. Many individuals do not fully understand the nature of their learning disability and as a result tend to blame themselves for their own difficulties. They have a hard time tolerating the challenges of school, work, or social interactions and feel more stressed and anxious. Dyslexia can also affect a person's self-image. Students with dyslexia often end up feeling dumb and less capable than they actually are. Depression is also a frequent complication in dyslexia. The depressed child is unlikely to be lethargic or to talk about feeling sad. Instead, they may become more active and misbehave to cover up painful feelings. An important element of dyslexia is the effect it has on behavior. These can be avoidance, resignation, and acting up. Avoidance is extremely common behavioral issue among dyslexic children, and it is used as a coping mechanism. They will often use a variety of means to avoid reading, spelling, and writing because they want to avoid all possible situations in which those difficulties might be exposed. Resignation. Students with learning difficulties tend to become withdrawn from educational situations over time if their learning difficulties are not addressed. Many dyslexic students begin to lose motivation for academics because they feel that they are beyond help and will not be able to learn. Dyslexic students who have not received treatment for their dyslexia may also begin to act out. This is a coping mechanism to draw attention away from their inability to perform at the level that is expected of them. They may also act out simply because of frustration, and as a result, they act out towards the students around them as well as their teachers. These are just a few of the behavioral consequences that can occur when dyslexic child does not receive proper treatment for their learning challenges. Schools can implement academic accommodations to help students with dyslexia. These include accommodations involving materials, accommodations involving interactive instructions, accommodations involving student performance. Students spend large portion of the school day interacting with materials. Accommodations involving materials can enhance the learning of dyslexic students. These can be clarifying and simplifying writing directions, such as underlining or highlighting significant directions, presenting a small amount of work. This can help students with anxiety, blocking out strenuous stimuli, such as covering up a section of the page that is not being worked on, and using assistive technology, such as audiobooks and tablets. Accommodations involving interactive instructions can assist teachers to gain student attention and keep them engaged for a period of time. This can be asking the student to repeat directions in their own words, maintaining daily routine because students with learning problems benefits from structure, using step-by-step instructions like presenting new information in small sequential steps, simultaneously combining verbal and visual information such as visual displays for lecture. Accommodations to enhance student performance include placing students close to the teacher. This helps students with attention problems, allowing use of instructional aid such as number strips, counters, or calculators, using peer-mediated learning such as partner reading, and allowing flexible work time. This will allow additional time for slow workers. This is the end of my presentation. Thank you for watching.